Good morning, everyone. My name is Jacques Clerville. I'm an epidemiologist on the long-term care unit team. Today, I will be presenting on data reported to the long-term care facility component, a component of the National Healthcare Safety Network. What is the National Healthcare Safety Network? NHSN is a CDC's healthcare surveillance system for tracking healthcare-associated adverse events, especially healthcare-associated infections. NHSN is used to track healthcare-associated practices such as infection prevention and control practices and antibiotic use. Participating healthcare facilities use the NHSN web application to report, analyze, and share data. They can also access NHSN to generate their own reports. Data reporting can be done manually or electronically. Data reporting to NHSN is also shared with CMS. NHSN has 7 components: the patient safety component, the healthcare safety component, the dialysis component, the blood safety component, the long-term care facility component, the outpatient procedure component, and the neonatal component. This presentation will focus on the long-term care facility component. The long-term care facility component has 4 modules. The COVID-19 respiratory pathogens module uses the pathway data reporting tab, also called the resident impact and facility capacity pathway, for weekly reporting of newly positive COVID-19 test results and COVID-19 deaths among residents. This module is also used for the reporting of newly positive COVID-19 test results among staff and personnel, for the reporting of number of hospitalizations with a positive COVID-19 test result among residents, and number of hospitalizations with a positive COVID-19 test result and up-to-date status among residents. Those weekly data are aggregate level data. Facilities can also access the COVID-19 respiratory pathogens module to report point-of-care test result data, COVID-19 vaccination data among residents and healthcare personnel, and person-level COVID-19 vaccination data among residents and healthcare personnel. The second module of the long-term care facility component is the multi-drug resistant organism and Clostridioides difficile infection event reporting module. This module is also called Lab Identify Event module. Third, the long-term care facility component has a module called Healthcare Associated Infection module. This module is used for the reporting of urinary tract infection events. Lastly, the long-term care facility component has a module called the Prevention Process Measures module, which collects aggregate data on hand hygiene and use of gown and gloves. The data reported to this module is reported under the Summary Data tab. This tab is also used for denominator data reporting, such as number of resident days and number of urinary catheter days. Data reporting to NHSN, which is CDC's surveillance system to track healthcare-associated adverse events and practices, falls under public health surveillance. Public health surveillance is public health practice. Public health surveillance is the ongoing and systematic collection, management, analysis, and interpretation of health-related data to support decision-making. NHSN is a passive surveillance system, which means facilities report their data to NHSN as part of their routine activities. Now, My colleague Selom will be taking over. Thank you.
Thanks, Jacques. Now I am going to talk about data reporting. The use of the data reported to the long-term care facility modules. What do we do with the data reported? The first thing that we do, we perform data quality check, which is a data validation activities that the members of our team perform before we start analyzing the data. This to make sure there is no irregularity in the data. The other activities that we perform is to create weekly and monthly reports. There are data that are reported weekly, such as COVID data, and there are data that are reported monthly. Those are lab ID events data, UTI events data, process measure data, prevention process measure data. We also use the data to feed our weekly dashboard. I will elaborate more on the dashboard in the coming slides. We use the data to conduct facility outreach activities for facilities that have reported a higher number of cases among residents and or staff. This allows them to confirm or review or correct the data. Here we have an example of the weekly data report. Here in the weekly data report, we have the weekly COVID-19 cases, rates of residents and of staff at the national level, regional level, and state level. From the information in the weekly data report, we can determine whether the COVID-19 case rate remains stable, increases, or decreases. We also perform the weekly state report. This is a state-specific report. In the weekly state report, we have information such as the number of skilled nursing facilities reporting into the NHSN long-term care COVID-19 module, COVID-19 cases and deaths amongst skilled nursing facility residents, COVID-19 national rate, case rate, hospitalization coverage for residents, vaccination coverage for residents and staff, COVID-19 potential outbreak alert. Here's an example of the dashboard. So we have a weekly dashboard that is updated weekly on the CDC website. It is publicly available on the CDC website. In the dashboard, we have information regarding the residents and staff, including COVID-19 case count, case rate, death rate in skilled nursing facilities. The two pictures showing on this slide are taken from the dashboard. On the top, we have the confirmed COVID-19 cases among residents and rate per 1,000 resident weeks in nursing home by week in the US from the period of 2021 to 2024. We can see that the peak of COVID case and COVID rate was reached in 2022 in the nursing home, in the skilled nursing home. The picture below is showing the death rate among resident and rate per 1,000 resident weeks in nursing home by week from the period of 2021 to 2024. Again, from this picture, we can see that the peak of the death rate was reached in 2021. The other activity that we do is data dissemination. The results of analyzed Data of the analyzed data are first reviewed by the team. Data are also interpreted and presented into team meetings. Reports are produced and shared with the CDC partners. The CDC provide this data to the CMS to help carry out quality improvement initiatives, as well as to fulfill reimbursement and facility reporting requirements. On a regular basis, the CDC participates in conferences across the nation. As a result, interesting results from our surveillance data are sometimes disseminated in conferences and as posters and or abstracts. We also submit manuscript to scientific and peer-reviewed journals. Here's the recent publication by the post-acute care team. The name of the publication is the COVID-19 coverage and rate of SARS-CoV-2 infection and COVID-19 associated hospitalization among residents in nursing home from the period of 2023 from the period of October 2023 to February 2024. So I'm not going to talk about the publication itself. My colleague David Franklin, who is the first author on this, will talk more about, will present this publication later during this training. What I just want to mention is that this publication received Altmetric attention score of 81 and was cited by 6 news outlets, including Yahoo. So in the next couple of slides, we're going to demonstrate how to pull data from the NHSN application for facility-specific analysis. The first thing that you do is to log in to the NHSN application from the SAMS portal. Then a page like what is showing here on this slide will appear. Then you hover over analysis under the NHSN home tab, and a small window will appear. And you click generate dataset. Once you click generate dataset, another page will open. So this page will open. The page generate dataset, long-term care facility, reporting data generated. Then you click OK. At this point, the dataset is already generated. Then the next thing that you do is you're ready to view the dataset. You're ready to view the report. The picture on the top is showing how you can view the report. Then what you do is that you go back to the NHSN home tab under analysis, you hover over analysis, and then this time you click on report. Then to view the report, then the page of the report will appear. The page shows analysis report. And from there, you will see different type of data sets that are available. And then you just select the type of data set you are interested in. Then you can run the report, modify the report, or export the data set as shown in the picture below. And this is how you can generate a report from the NHSN application. And these are the references. And this concludes this presentation. Now we are ready to take questions.